right, we can talk. There you go. You all
Just
right?
have a seat, the nurse will knock it off.
Anita, would you like to come in, please? Hello, Anita.
Hello.
I'm Helen.
Oh, Helen.
Hello. You don't mind the staff and myself calling you Anita when you come into hospital, is that all right?
Yes.
That's fine then. Now, my job today is to make sure that you're safe to have an anaesthetic for your operation that you're coming in for on the 23rd of December, okay? And because you're going to be put to sleep for this, you're going to have a general anaesthetic, so it's to make sure you're safe. So what I'm going to do is ask you some personal questions about yourself first, then I'm going to ask you lots of questions about your medical history and your medication. I'm going to do some observations such as your blood pressure, your height, your weight, listen to your heart and your lungs, and this is all to make sure that you're safe to be put to sleep. General anaesthetic for the operation on your hand. Is that all right? All right. So it's Anita Smith, and your date of birth the 23rd of December 1959. Are you Miss or Mrs?
Miss.
Miss. And single. That's lovely. And we've already said you don't mind the staff calling you Anita. Is that all right? Now, I'm going to check your GP's, Dr. Jones. Yes. That's Farnham Medical Centre. Now, have you brought your health record in with you, Anita? Thank you. I'm just going to have a quick look through if you don't mind. That's fine. But when you come in, will you remember to bring this book, because the nurse and staff will need to see it on the ward as well. It just gives them lots of information about yourself. So I'll give that back to you. Lovely, thank you. We'll just finish off the personal details section of this form, and then we'll move on to your medical history. So can you tell me your phone number? That's great, Anita, thank you. That's your personal details finished. Now I just need to confirm that you understand it's an operation on your left hand,
Yes.
and that you're going to have a general anaesthetic. That means you're put to sleep for this. Okay, you understand that? You're happy with it? That's great. Anita, I just need to ask you some questions now about your general health and your medical history. Now, I've already checked in your health record, and you're otherwise quite well, apart from the operation you've had before on your hand. No problems as diabetes, no heart problems, and is your blood pressure all right? And have you ever had a blood clot in your leg or your lungs before? And no circulation problems to your legs. That's because we do a risk assessment, and if necessary, you'll be given a pair of these white stockings to wear. Now I'll just show you one here, Anita. These are the stockings. Now these help your circulation, and the nurse and staff will measure your legs when you come in and get you fitted with the stocking that you'll wear for maybe 48 hours after your surgery. Okay, right, that's all of that section completed. And we'll move on to your previous operations. I know you had an operation on your hand last year, and you were put to sleep. You had a general anaesthetic. You didn't have any problems with the anaesthetic?
No.
Great. Now I'm going to move on to a few different questions. Do you smoke?
No.
Any alcohol? Do you drink
No.
at all?
No.
No, that's great. And now we'll go on to your medications.
Tablets.
What tablets do you take, Anita?
Paracetamol.
And you just take them when your hand hurts?
Yes.
Great. Anita, are you allergic to anything you know of? Now that's tablets, metals, elastoplast?
No.
That's fine. No history of chest pain?
No.
You don't get any palpitations in your chest?
Palpitations. This is when you feel like your heart is fluttering or beating very fast.
No, that's great. And just a normal diet? You're not on any special diet at all?
No.
Right, Anita, now it's time. I'm going to do your blood pressure for you. I need to listen to your heart and lungs. So we'll start that, okay? Anita, I need to put this on your arm. Can you roll your sleeve up for me, please? That's lovely. Now, you've had your blood pressure done before, so you know this is going to go quite tight on your arm. Yes? I'm going to pop this on your finger, and this just measures the oxygen in your blood. Okay. When you have your anaesthetic and you're put to sleep, you probably remember you'll have all of this monitoring equipment on. This tells the anaesthetist how much oxygen's in your blood, making sure you're safe.
Anaesthetist. This is the doctor who will prepare you and look after you when you're asleep, when you have your operation.
Your blood pressure will be done every few minutes, and they'll put some little stickies across your chest to measure your heart rate and your heart rhythm. So the anaesthetist and the anaesthetic nurse know you're quite safe throughout all of your anaesthetic. Okay, and that's fine there. So we'll take these off now.
Yes.
No problems there. That's great. Right, Anita, can you stand up for me, please? I'm going to listen to your heart and your chest. Is that all right?
Yes.
I'm just going to put the stethoscope on your chest and you can just breathe normally. That's lovely. Now if you just turn around, now can you take some nice deep breaths in and out? And again. That's great. Lovely. And again. That's fine. Thank you very much. That's lovely. It all sounds fine. Now we've done that, Anita, I have to do some swabs. One goes up your nose and one goes under your arm. We'll do these to check that you don't have MRSA.
MRSA. This is methicillin-resistant Staphylococcus aureus. It's a germ that lives on the skin and may cause problems if you have an open wound.
Anita, would you like to do this yourself or would you like me to help you?
Oh, Helen, help me.
That's great then. That's lovely. And then this one goes under your arm, might tickle a bit, that's it, and under that one. That's lovely. Just about finished now, Anita. Right, Anita, can I ask you to go on the scales for me, please? Marvellous. That's great, thank you. Just step off now, carefully. Come over here, just to check your height now. If you stand with your back there, that's lovely. Right, 5'7", 170 centimetres. That's lovely, Anita. Anita, I'm going to give you some information now. The first thing I'm going to tell you is you need to fast for your operation, for your anaesthetic.
Fast. This means you must not eat or drink anything.
So it's all written down here. Nothing to eat or drink from midnight. And sips of water until 6:30 in the morning. Now this is all written down for you. Now, would you like your sister to come into hospital with you and keep you company? Well, I'm going to fill out a form, a reasonable adjustments form, which just lets the ward staff, the operating theatres know that you're going to bring a relative in with you so they can stay with you all the time. And I'll ask if you can have a side room as well. All right? So this is your fasting times and we've wrote all of that down. And as we've just discussed before, that's information about your anaesthetic, and you know that the anaesthetist will come and see you before you go to theatre, explain all of your anaesthetic, and you have to sign and consent for that.
Consent. This is when you understand what is going to happen and agree to treatment.
The same as the surgeons will come along and they'll draw an arrow on your hand to make sure it's the right one. They'll explain your surgery and then you sign to say you're happy for them to go ahead with your operation. Now this is information that we've discussed earlier on about the risk of deep vein thrombosis and all the information about why you're wearing your white stockings to keep you safe. This is some information for when you go home. And the nurse and staff will give you painkillers, your follow-up appointments. If you needed a district nurse, they'll book you a district nurse for your wound care. But also if you need any help and support for home, they can organise that. Now you did say that you live with your sister, so you've got somebody to stay with you overnight and look after you, so that's fine as well. And that's some written information that were discussed before about your MRSA. All right, so you've got lots of advice in there. And then this last information leaflet's just information, privacy and dignity. You're going to be in a side room anyway, but Ward 4 does have men and women on the ward, but they do have separate toilets, etc. And you're going to be in the side room with your sister. All right? And as we discussed before, Anita, that's just some written information about your operation and your post-op care when you go home. You know you've got to rest and take it easy for 48 hours.
48 hours means 2 full days.
You'll have the bandage on your hand. Take your painkillers as you've been advised. Okay. And then we'll see you on the 23rd, and you know you're fasting from midnight. Just report to the reception area, and then we're all done now. But thank you very much for your time. Don't forget to bring your health record in with you when you come in as well for the nursing staff.
Thank you very much.
You're welcome, Anita. Now, before you go, like I said before, I need you to have these blood tests that the anaesthetist needs to make sure you're safe for your surgery. So we'll take you out to your sister, so she can take you down to the blood lab to have these done. And we'll give her your information as well for coming in.
When you're going to hospital, the health staff want you to feel as comfortable as possible. If you don't understand what the health staff are saying, please ask them to explain in more detail. You can also ask your family member or carer for support.
This is Frank.
Hello, Frank. Come and take a seat, please. How are you? My name's Diane. I'm one of the nurses looking after you today. Okay, Frank, I've just got to check a few details with you and ask you a couple of questions. Is that okay?
Yes.
Right. I'm just going to, is it okay if I check your bracelet to
Yes.
check your date of birth? And it's the 1st of February 1966. Is that
Yeah.
right?
Yes.
Good. The girls on the ward have checked your health record, Frank, and everything's fine. Could you tell me when the last time was you had something to eat?
Last night before I went to bed,
And what about something to drink?
same time.
Excellent. We ask you that because you have to have not eaten for 6 hours or had anything to drink for 2 hours for the procedure to be safe, Frank. Okay?
Understand.
Okay, Frank, so looking at your health record, you've got no allergies to anything, you've got no major health problems, and your blood pressure and everything's fine today, so we can go ahead.
Right.
You're here for an endoscopy, Frank. Do you understand what that means?
What's that?
Well, there's a few different types of endoscopy, but the one you're having today is called a gastroscopy, and it's where the camera goes down your throat and has a look all around inside your stomach.
You're taking photos of me inside of my stomach.
We are, yes. Now there's two ways you can have this test. You can either have a local anaesthetic throat spray which makes your throat numb, or you can have an injection which makes you feel a little bit drowsy. And I see you've chosen to have the throat spray, is that right?
Yes, that's right.
So that's all of my checks done, Frank, and the doctor will be along in a moment to speak to you. Is there anything you would like to ask me, anything you're worried about?
Will it hurt?
Well, it doesn't hurt. It's a little bit uncomfortable, but it'll all be over in less than 5 minutes. This is the doctor now, Frank, so I'll leave you with him and I'll see you inside.
Hello.
Hello Frank, nice to meet you. My name's Dr. Rajaseka. I'll be doing a test for you this morning. Okay, so
Yeah.
grab a seat here. Okay Frank, so I understand you haven't had this test before, so I'm just going to talk through it with you today and obviously give you the opportunity to ask any questions that you might have. So to tell you, it's a camera test which involves the camera going in through your mouth and into the food pipe, the stomach and the first part of the bowel. Okay, the camera is about the size of that pen across. Okay, and it passes into your mouth first and then past the back of the throat, and it can feel a little bit tickly at that point. but that will pass as the camera passes the throat. We might ask you to give a swallow to help the camera go into the food pipe, but that generally is no problem. And as we go into the food pipe, we introduce a bit of air, so you can feel a bit windy or a bit bloated as that air goes in, and the reason for that is so we can get a good view of the food pipe and the stomach and then the bowel. Okay? It only takes about 5 to 10 minutes, so it's quite a short procedure, and it's very, very safe as well. But with any type of procedure like this that's called invasive, and what that means is that the instrument, like the camera, passes into the body, there are some tiny, tiny risks that go along with that. The main thing that we warn patients is that there's about a 1 in 5,000 chance, a very, very small chance, of damaging the lining of the stomach with the camera. Okay? So, is that clear, and do you have any questions about that?
I understand.
Okay, Frank, I can see from your notes that you've been suffering a bit of indigestion recently. Can I ask you when that tends to come on?
When I eat.
When you tend to eat, okay. So this test, this camera test of the stomach, might help us understand why that's happening. So I think it's definitely a good idea that we go ahead with the procedure. Just before I take your consent, I need to check whether you understand what's going to happen. So could you tell me what you understand about what's going to happen next?
I'm going to numb my throat with a spray.
That's right.
Then you're going to put a camera into my stomach.
That's right.
Going to take photos up to see what's wrong in my stomach.
And do you remember me saying there was a tiny, tiny chance of the camera damaging the stomach lining?
Yes, I know I want to do it.
Okay, now that I'm clear you understand what's going to happen, we need to sign some of the paperwork. So this is the consent form for the test. First of all, I'm going to sign, and that's to say that I've spoken to you about the test, that you understand the test, and that you've had a chance to ask me any questions you had. Okay? I'm just going to turn over the page, and I just need you to sign next to this cross here, and that's to say that you're happy to go ahead with the test. Okay, that's great. So that's all the paperwork done, and now I'll take you through to the room. Okay, so if you follow me.
Come in, Frank. This is Barbara and Ali, the other nurses who are looking after you. Can I get you to take your coat off?
Yeah.
And I'll keep that for you.
Right, Frank, if you'd like to just come and take a seat here, please. Have you got any dentures or any false teeth?
No.
Right, Frank, the doctor says you want throat spray, is that right?
Yes.
Right, now this doesn't taste very nice, okay? So all I want you to do is open your mouth wide and I'll just spray. That's it. Now if you swallow that down, Frank, and then we'll repeat it again in a moment. Okay? Open wide again, Frank. That's it. Okay? Right. What I need to do now, Frank, is just take your glasses. Thank you. And I'll have you lying down on your left hand side. That's like facing towards me. Head on the pillow. Just pop your head right across here, Frank. That's smashing. You can put your feet up.
Frank, I've got a little probe to put on your finger.
What's that for?
It's just so that I can monitor your pulse while you're having the test done. Is that okay?
Yeah.
Frank, this is a little sucker that we use if you have any dribbles. So I'll just be using that, okay?
Just like the one at the dentist.
Yeah, just like at the dentist. Right, now Frank, this is the mouthpiece. This is to protect your teeth in our scope. So this just goes into your mouth, okay? Just open your mouth, Frank. That's smashing. Just rest your lips around it. And if you can just lift your head, that's fine. And I'll just secure that. That's smashing, Frank. Just pop your head back down. Now there's plenty of room for you to breathe there, okay?
Yeah.
You just breathe nicely in through your nose and out through your mouth.
Okay, Frank, is your throat nice and numb there?
Yes.
Okay, so this is the camera, okay? It's going to go into the mouth now, and what I need you to do is let it slide over your tongue and slide down the back of the throat there. Okay, so
Yeah.
here we go. Okay, Frank, so this is where I need you to take a nice big swallow for me.
Nice big swallow, Frank.
That's great.
That's smashing. The Frank, that's the tube down, that's the worst bit over. So you just think of nothing but that breathing.
Okay, and that's the test all done there. Okay.
Right, Frank, just let your head up this gently. I'll just get rid of all of this. Diane's got
Grab
a
there's some
bit of
tissue. And if you would just like to sit up,
Does it look like that?
there you go, all done.
Okay, there's your glasses back. You're absolutely brilliant.
Thank you.
Doctor will have a word with you in a minute once you get your breath back, okay?
Okay, Frank, you did really, really well there. Okay. We saw a bit of inflammation in the stomach, which could be explaining your symptoms, but it's certainly not anything serious or to be worried about. But when we see you in the clinic, we will talk about things in much more detail. Okay. And so now we'll take you back round to the ward. Okay.
Okay, Frank, if you come with me, I'll get your coat. We'll take you back to the ward, and then if you feel okay, you'll be able to go home.
Right.
Okay.
Right, Frank, you've had your procedure today. What they've done, they've taken a few samples and they've sent those off for histology.
What's that?
Histology is where, say if they've found a growth when they're carrying out the procedure, they would take a little sample of that growth and they would send it off to be checked out to see if there's anything growing there. Okay?
Okay.
Do you understand that?
Yes.
Yeah? But they have found that everything is normal. You don't need any further follow-up and you've been discharged. You can't have anything to eat or drink for an hour post-procedure. So that will take you to 1:20 for something to eat and drink. Other than that, everything's fine and you've been discharged. Do you have any questions?
No.
None at all. All we need to do is sign the bottom of there. This is your discharge.
Right.
Okay? And obviously I'll take your all-inclusive badge off. That's it. Right, that's it, Frank. You can go now. You've been discharged. Okay?
Yeah.
Thank you. Okay, you take care. Okay, bye.
Hi.
Lovely. If you just have a seat, someone will be with you very shortly and we'll go through your safety questionnaire with you, okay?
Okay.
Hello David, I'm Debbie. I'm here today to do some MRI scans of your head.
What's an MRI scan?
MRI stands for magnetic resonance imaging. What we're going to do is use a big powerful magnet and radio waves to take some fancy pictures of inside your head. I'm a radiographer and I'll be taking your pictures today. But before we do anything else, I need to check your details. So I'm going to ask you to tell me what your full name is, what your date of birth is, and what your address is. Is that okay? David, could you tell me what your full name is, please? Because we're using a very powerful magnet to take your pictures today, I've got to ask you some safety questions to make sure that it's okay to take you into the scanner room. Is that clear?
Yes, it's clear.
Okay. Magnets attract some types of metal, so we need to make sure that there's no metal inside your body that could give us a problem during the scan.
Is that why you had the x-ray earlier on?
Yes, that's right. The x-ray showed us that you don't have any metal in your eyes, but I need to ask you some more questions about your medical history before we can take you through for your scan. Is that okay?
Yes, that's okay.
David, have you ever had any operations to your heart?
No.
You just have a seat on there for me, David. Lovely. Right, David, I'm just going to explain to you what we're going to do now. We're going to take you into the changing room to put you into a gown. Okay, because we need all your clothes to your underwear, then we'll lock them in the locker there for you. Any watches or jewellery that I have on you, we'll take them off as well. Do you understand?
Yes, I understand.
Right, David, before I get you changed, have you got any metal on you? Jewellery at all? Coins that you want to lock away?
Got me watch and me bracelet.
That's fantastic. We'll take them off and we'll pop them into a locker for you. Okay, David, just pop them into the locker there. That's fantastic. And I'll lock those away. Okay, David, this is the changing room here. Okay, the gowns are on the left-hand side, and we're going to get you to take all your clothes off apart from your underwear. The gown's actually the opening at the back and the tie at the back, but give me a shout and I'll tie it for you. Are you ready, David?
Yes, I am.
Lovely. Come on out then. Right, we're just going to get you to sit on this chair here, and then Debbie will just come out and explain before we take you through to the scanner room what's next, all right?
Okay.
Hello again, David.
Hey, Debbie.
I'm just going to explain exactly what's going to happen during the scan today. First of all, the scan takes about 20 minutes.
Right.
Okay?
Yes. Yes, Debbie.
Scanner's very noisy when we take the pictures, so I'm going to give you some earplugs to make it a bit quieter. Okay, David, your job's just to keep very, very still during the scan. I'm going to give you a little buzzer to hold in your hand. All you have to do is press the buzzer if you're not happy at any point during your scan, and we'll stop the scan and come in to see you.
Can I listen to music, Debbie?
We can't give you music for a head scan
All right.
today, I'm sorry. For some scans we can,
Right.
but the headphones don't fit in the equipment we're going to use today.
Right. Will I need an injection, Debbie?
No, not today. For some MRI scans we do give injections, but the scan we're doing today you won't need one.
Right. Okay.
David, we're ready to take you round the corner and get you positioned up on the table for the scan now.
Yes.
I'm just going round now and get you all positioned up, please. Okay, David, this is the table that we're going to ask you
Right.
to lie on for your
Right.
scan.
Yes.
We get you to lie on your back with your head resting in the little cushion at the top there.
Yes, Debbie.
Okay?
Yes, Debbie.
Is that okay? Are you comfortable?
Yes, I'm comfortable.
That's good.
Okay, David, can you remember we were telling you that it's going to be noisy in the scanner room? We've got some earplugs here. Would you like us to put them in for you?
Yes.
Yes? That's great.
Okay, David, what we're going to do next is put a piece of equipment over your head that looks a little bit like a helmet.
Right.
And this helps to give us the pictures.
Right.
Okay? Okay, David, we're just going to slide this over your head now.
Right.
Okay, if you keep nice and still.
I will.
That's good. Now, what I'm going to do next is just pop a couple little cushions in at the side of your head,
Right.
and that'll help stop your head wobbling about during the scan.
Right.
This is the buzzer that I told you about earlier. I'm
Right.
going to put it in your hands.
Yes.
At any point, if you're not happy during the scan, all you have to do is squeeze the end. Would you like to practice?
Yes.
That's great. You can hear the noise, so that means it's working properly.
Right.
We're just going to take you through to the scan room now.
Yes.
Remember, David, the scan only takes about 20 minutes altogether, but I'll be speaking to you in between every set of pictures and checking that you're okay, and I'll let you know how long each set of pictures is going to take.
Right.
Alright? And you've got your buzzer, so you can press that at any point if you're not happy.
Right.
Okay?
Okay, Debbie.
Are you okay there, David? That's great. The next scan's going to take 2.5 minutes. If you keep very still for me, that'll be lovely. Okay, David, that's it all done now. You've done really well. I'm just going to come and bring you out of the scanner now.
What happened next?
Okay, what happens next is one of our doctors is going to sit down and look at all the pictures that we've taken today, and then they'll send the results back to your doctor who asked for the scan to be done, and they'll have the results within 5 working days. Okay, that's you all done now, so you're free to go.
Thank you very much, Debbie.
Okay.
Hello.
Can I help?
Anita Smith.
You got an appointment, Anita?
Yes, she's
Yes.
coming for operation on her hand
All
this
right.
afternoon.
I'll give you those back and I'll show you where you're going. All right?
Right, she's going to show her whereabouts you're going to be going, all right, Anita?
Anita, I'll show you where you're going.
Here's the nurse now, Anita.
Hello,
Oh, Anita.
you're Anita. I'm Claire and I'll be looking after you today.
Please
Can I
meet
just
you.
check what surgery you're having done today?
An operation.
An operation on your hand, right?
And I had it both sides done before.
Right, okay, thank you
Last
very much.
time.
Right, Anita, I'm just going to double check with your pre-assessment. Your name,
Anita Smith.
your date of birth
8th of March 1959.
and your address.
100 Horsley Vale.
Lovely, thank you very much. I was just checking that everything corresponds with that. Now, I need to ask you a few more questions that haven't been asked already and double check. Anita, this is your sister, isn't it?
Kim.
Right, I'm just going to give Kim the phone number. Kim's going to look after you tonight.
Yes.
So if you want to ring up in a couple of hours, then we'll let you
Do
know.
I just
how-
ring that number on
Yes,
the bottom?
yes,
Does that
please.
get you straight through to
And
this
that gets
ward?
straight through to this ward, yes.
And what time do you think I should ring up?
In a couple of hours. Anita, you're first on the list.
What's on this? What does that mean?
It means that you'll be going to theatre first, so you're less waiting around and you're first back on the ward and first to go home. Anita, I've got some questions to ask you. There's a yellow form that we need to fill in about your anaesthetic and about the checklist for going to theatre.
The anaesthetic, the man put me to sleep.
That's right, that's the doctor that's looking after you while you're asleep. And when you go down to theatre in the anaesthetic room, the nurse will ask you the questions again just to make sure you were you, alright? Checked with your pre-assessment. I'm just checking that you haven't been to your GPs and changed you any medication since you came to pre-assessment.
No.
No?
No, I think
Lovely.
all our tablets are the same.
That's all the same, right. We've got a white form which you've already signed for the surgery, but the doctor will come and see and put an hour on your wrist. Alright? Anita, can I just put your bracelet on? It's to identify you while you're asleep.
Right.
And it's got your name on, it's got your date of birth on, and the number that you're in for the hospital, okay? So it's everything just for you. Thank you. I'm going to continue with the questions on the checklist now, alright? You don't have a hearing aid,
No.
but you wear glasses.
Yes.
Do you have any false teeth?
No.
And I notice you've got a watch on, but you've got no rings or necklaces on.
No.
You've got earrings in.
Yeah, take them out.
Well, later on, if that's all right with you.
I got to take them out.
Because of being in theatre, it can cause problems with the electricity. I'll do your blood pressure shortly when I finish the questions. When did you last have something to eat and drink?
Last night.
Last night. You've had nothing to eat this morning.
No.
And you've had nothing to drink and you've had no medication.
No.
You don't smoke?
No.
Anita, I'm just checking your medication and it's all the same that you said it pre-assessment. And it says that you've got no allergies, is that right?
Yes.
You haven't had any rashes
No.
or been vomiting or diarrhea with any medication?
No.
Right, lovely, thank you
No.
very much. Anita, when you were at pre-assessment, you had your blood pressure, pulse, temperature
Yes.
and respiration done. I need to do them again now. And also, you haven't changed weight at all, have you, since
No.
your
That
pre-assessment?
was the same.
Lovely, right, thank you very much.
Because I haven't put on.
Anita, I'm just going to put the blood pressure cuff on your arm. That's lovely, comfortable. And that'll just go tight. Rest your arm down gently. Anita, I just need to put this on your finger to do your pulse and your oxygen levels. Alright, thank you. I'm just going to take your temperature, Anita. If you look at Kim, just going in your ear. That's all your observations now, Anita. Thank you very much. I'm going to ask you to put your theatre gown on next. Then after you put your gown on, you take your earrings out. I'll give you an envelope to put everything in, then Kim can keep it for you, alright?
I'll keep all your jewels.
I'll pull the curtains down and we'll do this. Thank you, Anita. And have you put your earrings in as well?
Yes.
Okay. And we'll get to the top, we'll turn left, Anita. Right, Anita, this is the anaesthetic room. And this is the trolley you'll be on.
And can I ask you to sit on the trolley as well, please? That's it. All right. Yes, please. And pop your head that way. I'm going to just pop the sheet over you, Anita. Are you comfortable on the trolley now? This is Derek. He works in the anaesthetic room, and I just need to tell him about you. All right? It'll just be 2 minutes, and then Derek will ask you the same questions. Okay? Derek, this is Anita's health records. A file. She doesn't score for TED stockings. She's got no allergies. She did have metal in her left arm, but that's been removed. This is Anita's sister Kim, who I said could come to the anaesthetic room.
Hello.
Thank you.
Cheers. Hi Anita, I'm Derek. As Claire said, I'm going to just check a few details, okay? And ask you a few questions. Right, so now just have a look at this wristband. Can you confirm your name, please?
Anita Smith.
And your date of birth?
I think it was when I was 15 and I had my birthday.
Well, that's great, Anita. I just need to have a look at your hand there. So you've got an arrow here to indicate that we're operating on your left hand. The doctor's put that there, yeah. Doctor's also signed your consent to indicate that we're operating on your left hand as well, okay? Alright, so we just need to go through this yellow checklist one more time. I know you've already been through it, but we'll have to check again, okay? So, Anita, I'm just going to put some monitoring on you, okay? What I'll do is I'll put these ECG dots on. These will measure your heart rate. Okay, so we've just got one dot on the right here. We're going to put a blood pressure cuff on you. You pop it on this arm because you're being operated on this arm, alright? This will measure your blood pressure. Connect that up. And put a pulse oximeter on this hand again because we're operating on that one. It's just going to measure your oxygen levels through the operation, okay? So before you go into theatre, Anita, I'm just going to pop this into your hand. This is what we'll deliver the fluid and the drugs through, which will pop you off to sleep, okay?
Hi Anita, you're back in recovery, okay? We'll just let you wake up. Okay?
Hello, Anita. Are you alright?
Take care.
Turn you onto your side, roll over towards me.
Take it nice and take your time, Anita.
That's it. Just hang on a minute, right. Back onto your back. That's it. Arms across your chest. No, arms across your chest. That's it. Lovely. 1, 2, 3. There we go. Thank you for letting me do your blood pressure. All your observations have been done now. This is the nurse call button. But press that button if you want anything. I'm just going to do your paperwork. I want you to have a nice little sleep. I'm just going to lower the bed. And then you have a nice little sleep, alright? And then Kim, your sister, will be here, okay? Thank you.
How do you feel, Anita?
Alright.
Do you want to sit up?
Yeah.
Right, do you feel better sitting up?
Yes.
Right, are you happy? Do you think we should be getting you home soon?
Yeah.
Good.
Here's your cup of coffee like you asked for.
you.
You've had a good little sleep. So we'll have a cup of coffee, see how you feel, and then we'll get you home. How about that? Hi Anita, are you enjoying the cup of coffee? Good. Can I give you some information and then we'll let you get dressed and see about getting you home? This is a letter for your GP. Tell them about the operation you've had. And you or Kim could just drop it in at the GP's. Is that alright? And then this is an information sheet about your surgery and you need to get your stitches out in 10 days. But the nurse at the GP's will do that. And I'll need to give you a couple of dressings as well, alright? But I would probably go to the GP's in 3 days to see the practice nurse. Kim, is there anything you want to ask?
No, you've explained everything very well.
Or is
Thank
there
you.
any oozing coming casually?
We'll get you home now, okay, Anita?
Yeah.
Just going to close the curtains, then we'll get you changed back into your clothes to get you ready for going home.
Yeah.
There we are, then we'll get you home.